Ward 22, Nurse Fullman. Oh, hello. Yeah, only the one bed at the moment. How's things with you, then? I'm on with Audrey Steiner from the agency. Just my luck. Did she? Oh, that's typical. Yeah, she's efficient, all right.
Nurse.
Oh, I better go, love. Yeah, cheers.
Nurse.
Now, you should be asleep, Mr. Summers.
I can't sleep. I'm hot. Can't you turn this thing off?
Of course not. It's there to help you.
It's like being wired up to a television set.
Have you got a pain anywhere?
Yes, as a matter of fact, I have. I've got a pain right in the arm.
Tongue up, tongue down. Shh. Let me take your temperature first. And you can rub it on as much as you like. As long as you do it quietly.
Oh, I'm sick.
You know, the trouble with you is you won't give yourself a chance. If you weren't so impatient, your heart wouldn't be giving you any trouble.
Who says I'm impatient?
Shh, you wake everybody up.
I have been known for my patience. Ask anybody. Well?
You're half a degree over.
What does that mean?
That means you can stop worrying, you're all right.
Who's worried? I just want to get some sleep.
Then I suggest you close your eyes and think of nothing.
Oh, is that what you suggest?
Good night, Mr. Summers.
How are you getting on?
Not too bad. Trying to get in a bit of study.
Revision?
For me exams. Be glad when they're all over.
Any customers?
No, not yet. We will, though. Casualty came through checking our beds today.
Oh, busy, are they?
Sounded like it.
We must make a start with a chart soon.
Yes.
And do Mr. Timley's fluid chart.
It's all done.
Oh, good. Did you check Mr. Andrews, is it? Blood pressure.
Mr. Scott. Yes, I checked.
Oh, good.
Mr. Summers felt a bit flushed earlier.
He's the one on the monitor.
That's right.
Did you take his temperature?
Yeah, he was half a degree over.
What about the monitor?
Seemed all right, pretty steady. Bit fast, though.
I better have a look.
Well, there's no need. He's probably asleep by now.
All the same. Yes, he looks fine. Still, you can never be too careful.
He was all right. I told you I checked it.
Yes, I know that. I was just making sure.
Yeah, well, that's up to you.
Yes, it is, nurse. Now, if you don't mind, I think it's time we turn Mr. Bridges over. Oh, you'll be the ruin of my back, Mr. Bridges. You really will. Come on now. That's the idea. Over on your side. No trouble at all, was it? That's Mr. Bridges done for a while. Think we'd better go to lunch soon.
Look, there's something I want to say to you.
Is there?
I don't like the way you keep checking up on everything I do.
You're not asked to like it.
You seem to forget that you came here last week and you're leaving next week. I'm here all the time and I know the way this ward is run.
And you seem to forget, nurse, that I'm responsible for this ward.
How can I forget? You make it blatantly obvious.
Only because I have to.
And what's that supposed to mean?
Shh.
I asked you a question. Where are you off to?
What's the time?
1:30.
Where did I go at 1:30 last night and the night before? And come to think of it, every night for the last 2 weeks.
Mr. Pointer, the nights are for sleeping, not for making tea.
Listen, nurse, you're a nice girl, but try to understand this. For 23 years, I've worked for the same company on the same shift in the same place. Start at 9 at night, finish at 6 in the morning. Dinner between 1:30 and 2:15. If the nights are for sleeping, you can do me a favour and go and tell my governor. I'm sure he'd be happy to talk to you.
All right.
Just the night shift off for his dinner.
Regular as clockwork.
He's in his own time now. Don't come back till 2:15.
If we check that drip now, you'll be free to go to lunch.
Okay.
Ward 22, Nurse Steiner speaking. Yes, Miss King? Mr. Wallace? Yes, of course. Thank you. Customer.
Oh, no. I was looking forward to a break.
Let me help you up, Mr. Marshall.
I can't get my
Pull
breath.
the curtains, nurse. Respiratory.
Yes,
I don't want anyone to be put about.
Hold on to the table.
All right.
You're all right, Mr. Marshall.
Where's his oxygen? No need to worry. Just relax now.
Shall I call Dr. Crozier?
I don't think so, not for the minute anyway.
He likes to be informed.
He will be. How do you feel now?
It's a little better, thank you.
Do you feel tight around the chest?
No, I'm all right now. I just feel sleepy.
You get some sleep then. I'll tell the doctor in the morning. Come on now. Let's get you comfy. Good night, Mr. Marshall.
Good night.
I think he'll be all right for tonight.
So we ought to mention it to Dr. Crozier when he does his rounds.
Of course we will.
Aye, aye.
Good evening, Miss King.
Good evening, nurse. His notes. Now, Mr. Wallace, we're going to put you into bed so that you can get some rest. All right? Well, come on, let's have him in, then. Over you go. That's it. Fine. Now, careful of his arm. It's a bit bruised. All right, Mr. Wallace? Turn over. That's it. And back. Fine. Now keep him propped up, nurse.
Yes, Miss King.
Thank you. There you are, Mr. Wallace. Now, the nurses will look after you, so try and get some rest. How's your head? Is it still aching?
A bit.
Well, you'll feel better when you've had a sleep. All right? put him on an hourly pulse and neuro observations.
Yes, Miss King.
And blood pressure.
Blood pressure.
His name is Roy Wallace. Mild concussion and some bruising will just keep him in overnight for observation. Oh, and his wife has been informed, so she'll be up first thing in the morning.
Right.
Is it all right to go to lunch now?
Yes, that's fine.
Shan't be long then.
Well, what else have you got tonight?
Mr. Marshall was having some trouble with his breathing earlier.
Oh, has the doctor seen him?
I thought it best to tell him when he did his rounds.
Good. Anything else?
No, I don't think so.
Well, you've no more spare beds, so you should be in for a quiet night.
With a bit of luck.
Thank you, Ness.
Good night, Miss King. Going to take your blood pressure, Mr. Wallace.
I was thinking, it's my wife. I really ought to...
She's being told. She's coming first thing in the morning.
Be hell to pay over this.
Oh, I hope I get off night soon.
What's the matter with you? I thought you preferred night.
I've changed my mind.
Yeah. You know she's going out with, don't you?
No?
Larry the Grover. Never. It's true, Carol told me. Imagine, just looking at him gives me the creeps.
You hungry?
Starving. Only chance of a cooked meal I get.
What you been up to then?
Not a lot. Just studying.
Oh, yeah.
It's the truth, I'm not very confident.
Everybody that says that normally passes with flying colours.
Well, I won't stay on if I fail. No chance.
You can't do that. You've come this far, you can't just chuck it in now.
Well, can't I just? There's other things besides nursing, you know. There's a world out there for a start.
You're always threatening to chuck it in.
Well, maybe this time I will.
Working with Shirley Brent?
No? Why?
I haven't seen her around, that's all.
Saw her in the library yesterday. Her head stuck in a book, as usual.
Never stops, that one.
Oh, Ruth.
Well,
She's not as bad as some of them.
oh no. Who's this? Audrey Steiner.
Fullman here doesn't reckon much on her.
She's a very good nurse.
Like a ruddy robot.
She's always bitching on about something.
You don't have to work with
Or
her.
someone.
She breezes in here without knowing the hospital or the ward and then takes charge over people that work here full time.
She has to take charge. She is qualified and we are not.
Yeah, but you've got to offset her qualifications with a lack of familiarity with the ward.
How are things with you, then?
Fine. My lovely ladies are all sound asleep, so I should be in for a quiet night.
Is Jo on nights as well?
She hell.
How does she do it?
You know, she must get at least twice as much money as us.
She hasn't done night since she was on ops, has she?
No.
At least twice as much.
Hey?
Audrey.
You could always ask Sister for a transfer if it's that bad.
Yeah, that's an idea. But no, why should I run away? People like us should have made a stand years ago. We do a hard enough job. We shouldn't have to economise for a month for a pair of tights and a Chinese takeaway.
You don't have to convince us.
Then you know I'm right.
No one's actually saying you are wrong, Ruth.
But that's what I object to. Audrey's nice enough as such.
Well, then.
Well, she's probably so dumb that she doesn't even realise if there weren't any agency nurses, we would get what we were asking for.
Well, I think she's doing as good a job as we are.
Do you?
Yes. Look what she's got to put up with. She's got no friends in this hospital, and she knows it.
She's got two.
She also knows most of the nurses are bitching on her behind her back.
Quite rightly.
It's not quite rightly. Would you do it? Oh, well, I've got to go.
It's not time yet.
I'll see you tomorrow.
Hang on, I'll come with you. See you, Sita. Bye. What's the rush?
Dr. Crozier will be doing his rounds soon. I want to talk to him about one of the post-ops.
Oh, yeah, you fancy him, don't you?
Who doesn't? Listen, what you were saying, you're right. It's just you do go on a bit, Ruth. Mr. Stocks.
Again?
It's a bit embarrassed.
So it should be. Nothing happening.
No, it's all been quiet. I think it's going to be a slow one.
Well, shall I do the charts?
If you like. There's only the 2 end beds left to do.
Oh, I see.
Well, it was better than twiddling my fingers. So you have a nice lunch?
Had a sandwich.
That's all?
I wasn't hungry.
I can't say I blame you. The food here is not up to much, is it?
It's not that bad.
You only really know this hospital. At the Russell, the food was much better.
Was that your last place?
I was there a couple of months ago through the agency.
Of course.
I did a month and then had a few weeks off.
Do you have a lot of time off?
Not really. Every couple of months or so. I like to get out of London, you know, travel around a bit.
Yeah, I'd like to travel.
Went to Paris with a friend.
Sounds nice.
Oh, it was smashing. Didn't want to come back.
No, I don't suppose you did.
Well, would you? I mean, just look at it.
Why did you come back?
Don't you ever feel like getting away from it all?
Nope.
Never?
Never.
Not even for a few days?
Why should I?
After you're qualified, you'll feel differently. You'll really need a break then.
Oh, I doubt it.
I better check Mr. Scott again. Okay?
Yep.
Do you fancy sorting the drugs with me? The day nurses have left them in a bit of a state.
Oh, I don't mind. We ought to do pharmacy as well.
Oh, I suppose so.
I don't care how they leave it as long as they get off on time.
It's like that in every hospital I've been in.
It's even worse tonight.
Let's sort these respiratory ones first.
Right.
Dr. Crozier's taking his time. He's usually done the early morning rounds by now.
I expect casualty have had some customers.
It's a bit late, I would have thought. Pubs have been closed for hours.
Maybe the roads are wet.
This one's antibiotic. Better put it with the others.
Right.
Maybe he's got someone in a corner.
How do you mean?
You know what they say about him. He's probably chatting up one of the nurses.
Yeah, I suppose he is.
How do you think you'll do in the exams?
Oh, I should scrape through with a bit of luck.
You're not too worried about it.
I don't see much point in worrying about it. Not like some of them do, anyway.
And that was my trouble. I worried about it so much I was a bag of nerves by the time I got to the exam room.
Get wrong.
Oh, my hand shook so much I could hardly write.
Well, I thought you'd have been dead confident.
I've always been that way over exams.
You don't really seem the type.
No.
No, not really.
What type am I?
Well,
Yes.
you like everything to be just so, don't you? Double-checking everything.
That's the job.
Or the way you see it.
In the interest of the patients, Ruth.
Ah.
Why else?
Well, I thought you could have had some other motive.
Like what?
Looking after number one. I mean, you have to, don't you? Being freelance.
So that's it.
What?
Come on, you know what I mean.
You not want it both ways, don't you? A fat paycheck and everybody loving you all at the same time.
Is that so unreasonable?
How much do you get for a night shift as a matter of interest?
That's my business.
I can guess.
Have you talked to Sister about this?
Sister?
I'm quite sure if she knew your feelings, she'd never have put us together.
Well, she does, and she did.
Well, perhaps I'd better have a word with her. Oh, good evening, Doctor.
Afternoon, ladies. What have we got today, then? Anything that needs my curing hand?
Just a couple of patients we'd like you to have a look at.
Really? Well, why not?
There's Mr. Marshall first.
Just a moment, miss. When I come into this ward, I have a very special duty to perform.
Oh, Frank, I thought you'd forgotten.
Oh, Ruth, how could I ever forget? Are you, pressed for time?
Not really, no.
Do you know, I haven't eaten since 6. This place is starving me.
You want me to knock something up?
Ruth, you can read my mind.
It is all right, isn't it?
I suppose so.
Oh, omelette, Frank.
Omelette would be fine.
Yeah, we don't be long.
No, I won't. Now then, where are we?
Mr. Marshall.
Oh, yes. Did he have a spasm?
Yes, he couldn't catch his breath.
I was afraid of that. Well, it's not looking too bad, though.
We gave him some oxygen and he seems to be all right.
Good. Well, that's all right. I think we'd better let him have a good night's sleep. Oh, nurse. If you get a case like this again, I'd appreciate a bleep.
Well, actually, I didn't think it was necessary this time.
No, but all the same, I like to keep an eye on these cases.
I see.
I think it best if you keep a check on him tonight. I'm not too happy with him.
Is he that bad?
Well, he's been getting steadily worse. We can't seem to clear him out at all.
He responded to the oxygen very quickly.
Yes, it's not that I'm worried about. He has a widespread tumour, and I'm just not sure about his lungs. They're under considerable strain.
Well, shall I check him hourly?
Yes, I think that's a good idea. Right, who's next?
The new admission, Mr. Wallace.
Yes, Mr. Wallace. I examined him. Have another look, I suppose. Oh, that seems all right.
Well, his pulse was fast.
Well, he must have been shaken up a bit.
What was it happened to him?
Had an argument with a lamppost. Under the influence, apparently.
Oh, dear.
He can consider himself very lucky.
I've got him on an hourly pulse and neuro-obs.
Good. Anything else?
No, I don't think so.
Right then, I'll be in the kitchen. Hunger is taking over. Where's it to be, then? On the table?
Suppose you want a cup of tea?
Of course. Oh, what a good wife you'd make.
Don't take the mick.
No, I mean it. Nurse, domesticated.
I wouldn't stake your life on that.
Someone to turn to in times of crisis. Makes a lovely cup of tea. Hot.
Serves you right.
Good breeding hips.
Watch it.
I am.
What are you doing?
Oh, it's my sheltered upbringing. I never had the opportunity of developing my creative talents to the full, you see. So now I sculpture omelettes.
What are you talking about?
Dribble. As usual. Just tiredness, really. Absolutely exhausted.
Yes, I know. I went to great trouble smuggling in these eggs. I hope you're grateful.
Oh, I am.
Never was much copper omelettes. They're either all runny or like bits of old leather. Still, aren't your stomachs as big as your eyes?
They're hardly looking, is there?
Depends.
Oh? What on?
On where the look leads to, I suppose.
Got any ideas, have you?
Just eat.
Beautiful. Fork? Here we go, then. Haven't got any salt, I don't suppose.
Oh, is this demanding?
Oh, yes, I can be, you know.
Yeah, and you talk too much. Nice?
Delicious. Where have you been lately?
Oh, you noticed then?
Oh, since you've been on nights, the parties have decidedly gone downhill. They're no fun anymore.
Yeah, and you like your bit of fun, don't you?
Don't you?
Anyway, how am I supposed to find the time?
Well, you could always nip over for a quick tango in between taking a temperature and cleaning the sluice.
You're daft, you are.
Only way to be in this place.
You, still get to the parties, then?
Me? I get everywhere. Casualty, theatre, wards. I can still fit in the odd party. And she's really nice, Ruth.
Good.
Thanks.
All quiet out there?
Not a murmur from anyone.
Lucky people. Nice quiet night to look forward to.
It never lasts long.
It's all right, Audrey, I'll do that.
It's all right.
No, really? I can manage.
Well, if you don't mind, I'll go and get those reports ready.
What to do to then?
Nothing.
Oh, bad as that, eh?
Call it a bit of personality conflict. Could happen to anyone.
Of course it could. I'm not saying a thing.
It hasn't helped being on nights.
Yeah, it can be a bit of a strain.
Yeah.
What you doing on Sunday?
Why?
What do you mean why? I'm asking you what you're doing on Sunday.
And I'm asking why.
Where's your romance? I thought we could listen to a couple of LPs.
Oh, yeah.
Or more, if you like.
No, thanks.
Why not?
Because I know what your idea of listening to a couple of LPs means.
What?
Forget it. Anyway, I don't want to stay cooped up inside all weekend.
What do you want to go out for?
Because it makes a change.
Where do you want to go?
Pictures.
In the afternoon?
Why not?
Bit of a shame, I suppose.
I am capable of going on my own, you know.
Are you quite sure you want to go out on Sunday?
Quite sure.
Gone off my LPs, have you?
They do tend to play the same old tune.
Well, we can always try a different one. Good evening.
Why aren't you on the ward, nurse?
Oh, I was just giving Dr. Crozier some refreshment, Miss King.
Oh. And what did the refreshment consist of?
Cup of tea, Miss King. And an omelette.
You are aware of the rules of this hospital, nurse, and you know that making a meal is a flagrant breach of.
Well, in actual
Not
fact...
just at the moment, Doctor.
I was just
I'd
trying
like to talk to the nurse, if you don't mind.
Couldn't see any harm in it. The ward was quiet and the doctor
Oh,
was
you don't
hungry.
seem to understand me, nurse, but the rules of this hospital are there to be obeyed, not broken.
If I may speak,
Yes.
I asked the nurse to make me a meal. I've been on duty since this morning and I haven't eaten since 6 this evening.
Yes, I do understand your situation, Doctor, but I can't have my nurses breaking hospital regulations in any circumstances.
What I am trying to say is, if anyone's to blame, it's me.
Not as far as I'm concerned.
Look, it's a perfectly reasonable...
Excuse me, Doctor, I would like to talk to the nurse. Now, I suggest that you change your attitude. You hold a privileged title, nurse, and I want you to recognize that.
Well, the doctor was hungry, Miss King. I couldn't see any wrong in it.
Oh, couldn't you? Well, perhaps matron can point out the wrong in it.
Yes, Miss King.
Attend to your duties, nurse.
Yes, Miss King.
Nurse?
Yes, Miss King?
Well, you can read that notice, I presume. Good evening, Miss King. I have just given Nurse Fullman a severe reprimand for making a meal. Now, will you see that this kind of activity does not occur on your ward again, please, nurse? Yes, Miss King. Good. Hello? Yes, I'll get her for you. Dr. Crozier on the line for you.
Is it? Hello. Yeah, it's nothing. It's not your fault. Well, it's just one of those things. Sunday. I thought you didn't want to go. Yeah, of course I want to go. Yeah, okay then. Yeah. Bye. Is it time to turn Mr. Bridges yet?
Yes, it's near enough, I would think. Bad luck about your skirmish.
Oh, I'm not worried. I've had it for 3 years. I can wait another couple of months. Right, time again, Mr. Bridges. On your back. There. I'm not worried about her. Don't relish a lecture from the matron, though.
Did you say she was telling matron?
Perhaps matron can point out the wrong in it, nurse.
Oh, dear.
I'm not worried.
She has got a point, I suppose.
Whose side are you on?
Well, she's only doing her job, after all. We'd probably be the same if we were in her shoes.
You might. I wouldn't.
You're taking me the wrong way again, Ruth.
No, actually, I don't think I am.
Look, you don't know what you'd be like if you were the number 7. At the moment, you're on the receiving end. You might think nothing of it if you were the one giving the reprimands.
Her way of doing the job is not the only way, and you should know that.
I do. But her way is more successful.
Only because the whole system responds to the way she shouts. It hasn't been given a chance to respond any other way.
Shh. Well, you don't intend to fight the health service on your own, do you?
Oh, there's plenty of people like me. There's plenty of people that want to see some kind of change.
But you go about it the wrong way. It's all wrong.
The only way to get anything done is to stand up for ourselves.
Ruth, change comes with time. It doesn't happen overnight.
We've been sitting around for years waiting for change.
But striking and marching doesn't help.
I don't suppose you object to the pay rises we get for you.
Ah, now, wait a minute. Got a bowl for you, Mr. Marshall.
Hold on to the table.
I don't want to put anybody out.
That's all right, Mr. Marshall. We're here to help you. Now, don't worry about a thing. You'll be fine in a moment. Breathe in. That's the idea. Just relax now. Get the doctor, number 7.
Right.
Hold on to the table, Mr. Marshall. That's the ticket.
Dr. Crozier and Miss King, we've got an emergency on Ward 22.
I'm feeling better. I'm better.
All right?
They'll be here shortly.
The doctor's on his way, Mr. Marshall.
Oh, I don't want him.
That's all right. Breathe in. That's it. Nice and steady. Try and hold him up a bit, will you?
I am.
Hold the table, Mr. Marshall. How is he? The oxygen isn't having a great deal of effect. Right, let me take that. Sit him up a little bit more, will you? And will you go around the other side? Right now, Mr. Marshall, let's see what we can do. Look, can you just bring him over a bit?
What's happening?
It's all right. It's all right now, Mr. Marshall. Everything's all right now. Just hold on to that table.
How is he?
Well, I think he's stabilising a bit now.
How long has he been on the oxygen?
About 2 minutes.
Give me 250 milligrams of aminophylline. I'll give it intravenously.
Yes, doctor.
Now then, Mr. Marshall, not doing so good, eh? So we'll soon sort that out. Can we pick him up a bit more? We need to get some muscular action.
That's it, Mr. Marshall.
Just relax, Mr. Marshall. I'm not too sure about his lungs. The oxygen doesn't seem to be doing any good.
I've got the aminophylline. All right now, Mr. Marshall. All right now.
Can you pick him up a bit more? Just you keep hold of the table, Mr. Marshall. Come on. You can take the mask off. Put him down. If someone could phone his relatives.
I'll go. Are you all right here? Yes, Miss King.
Get it tidied up now. I'll be at the desk.
Oh, there's some forms in the drawer.
How are you?
Oh, I'm fine. You?
Get the last officer's pack out, will you please, Ruth?
Right.
Don't think I don't know what's been going on behind them curtains.
What are you talking about?
You can't fool me, that's all I'm saying.
Just the cotton wool for the moment, please.
How much do you want?
Only a bit. Let's do the bed bath, Ruth, then we can get on.
Right. Ward 22, Nurse Fullman. Yes, Miss King. Yes, we will. Sorry? Me? Oh, I'm fine, thank you. Yes, honestly. Thank you, Miss King. Bye.
All right.
Bit deflated.
There are the final notes. Respiratory failure. I've signed them.
Thanks.
Come on. Cheer up. May never happen. Day out with the devastating Crozier, you'll come back a different person.
Do you mean it may never happen? It's been happening all night. I've had a good dressing down from the number 7. Been shoved around by her. And to end a lovely evening, I've lost a patient.
Come on, love. I know how you feel. But if you don't keep smiling, you'll hand in your bleeper and head for the nearest pub. It's the only way to survive in this job.
Yeah, I'm just tired.
Yeah, I know. I'll see you Sunday, eh?
Sunday.
2 o'clock.
Right.
Mrs. Marshall? Yes, dear. This is Miss King from the hospital. Yes, yes.
You must try and get some sleep again, Mr. Pointer.
Easier said than done, innit?
Let me take this pillow.
All that noise.
It's all right now. You just try and get some sleep. Good night, Mr. Pointer.
Good night.
I've got somebody coming for the mattress. Trolley been and gone?
Yes, and I've cleared away stuff.
Will you list the valuables?
Yes.
Ward 22, Nurse Steiner speaking. Yes. Casualty after a spare bed.
Oh, no.
You all right?
I suppose so.
Tired?
A bit.
Fuss of Mr. Marshall?
Must be. A bit depressed.
And, hits you harder when you're tired.
Yeah.
Still, got to stay on my feet. Going to the West End tomorrow, try and find something to wear. Can't find a thing locally. Do you fancy a cup of tea?
Oh, I'd love one.
I'll go and make it. And I'll put these in Sid's sink.
Thanks.
Thanks, Audrey.
Nurse. I'm hot. I keep waking up and I'm irritable.
Do you want me to take your temperature?
You might as well. I don't see what good it'll do, though. I shall take a pill tomorrow night.
I hope so. Your temperature's normal.
But I'm hot. Shh. What am I hot for if it's normal?
Just try and get some sleep again, Mr. Summers. Please?
Oh, I'll have a go.
Thanks.